Well, Buntingford Medical Centre, part 4. Today's the 29th of October 2021. On the 13th of October, Doreen had to go back to Broomfield. That's to have the dressings on her feet changed. The ambulance picked her up just after midday and she got home about 4:30 in the afternoon. She's very upset and in tears. She says the pain when they change the dressing is worse than ever. Now, the dressings on her feet, you've got to remember she's had all the skin removed. She's had skin grafts in the last couple of weeks. The dressings, it's a special dressing that's over the top of the grafts, I suppose, and then huge swathes of bandages over that, all with caked blood on that has dried, and pus from the sores, all stuck together, and they've got to get all of that off her feet. While they're doing that, she's got no pain relief at all. She said it's horrendous. Now, she's been in pain for 2 years, so knows what pain's about. She said this is worse than any of it. This time the nurses put on lighter dressings. Not lighter, but before they made her feet look like she had white moon boots on, bloody huge. Doreen's been told to bathe the open sores with warm water to remove as much pus as possible, then to put some cream on and redress them. The cream is called QV cream for dry skin. Now, I'm not exactly sure what QV cream for dry skin does for wounds that are healing with skin grafts. Still, there's the instructions. Thursday, 14th of October. I've sent an email to the medical centre in the vain hope that someone will see how grave Doreen's situation is. She still has her undiagnosed pain that she's had untreated, undiagnosed for 22 months. On top of that, she's now got the additional pain from having all the skin removed on both feet, skin grafts, bones protruding through her toes, and weeping sores on her feet. No pain relief. All she's got is a few antidepressant tablets. Depressed? Wonder why? Friday, 15th of October, Doreen phoned the Buntingford Medical Centre, spoke to a receptionist. They offered her an appointment on Monday the 18th. Another 3 days. 3 days more pain. Doreen said, I can't wait that long. I need to talk to a doctor today. She was told the same old thing. All of the doctors were under extreme pressure and were all very busy. But a doctor would call her sometime today. Well, Dr. Page phoned. You remember Dr. Page? She was the woman, after 20 odd months, came here once, the only doctor that's ever been in here 2 years, and asked Doreen what kind of pain management you think you should have. So she turns up. She said to Doreen, you've got to go and see Dr. Samuel at Lister Pain Management. But she didn't make any effort or suggestion, I'll make the appointment for you, Doreen. That's again left to us. Doreen has telephoned Dr. Samuel's secretary. We managed to get his phone number and left a message asking him for an urgent appointment. It's just like going round and round in circles. We've been through all this so many times. No one's willing to grab the ball and make a move to do something constructive. Still got the same question. Why are doctors the only people in the country who ain't open. My doctors are still behind locked doors. Saturday the 16th of October, yet another miserable day, with Doreen moaning, groaning all day and just being in bloody pain. Now, I can appreciate, having been in pain for 20 years with a damaged spine, that she's in a lot of pain. But being on the receiving end of her bad temper and bad manners is wearing a bit thin after 22 months. Sunday the 17th of October. Last night, Doreen decided that she was going to try and bathe her feet. Now, she's dreading this. She's got to try somehow and get them blood-soaked bandages off her feet. Then swab the wounds to get the pus off and then redo them. Well, she decided what she would do. I'd get a washing up bowl full of warm water with a little bit of fairy baby shampoo in. Put her feet in it for a while and just see whether it would make it easy to get the bandages off and maybe bathe them a little bit and treat the wounds. Maybe. That's what she hoped. Well, it didn't come off at all. Didn't work. And she can't bear to try and pull the bandages away from her feet, and she's crying with pain all the while and shaking and trembling. Didn't work. In the end, we dry her feet off best we can, wrap the bandages round, and we just hope. It just seems wrong that Doreen's at home and only goes to Broomfield once a week. Now, Broomfield is about a 60-mile round trip. The ambulance that takes her and brings her back is more like a taxi. It drops off people, picks up people, drops off, which means she could be in it for hours and hours. No pain relief, and her feet are killing her. Goes once a week. It's infuriating, really annoying and distressing to see that this is after 22 months. No one seems to be talking to anyone. No one's doing anything. It's always down to me and Doreen to try and initiate any kind of progress at all. Doreen's now been on low strength Oromorph, and so far it's done pretty well nothing. The same as all the other pain relief tablets that she'd over the last 22 months. But she can't complain at the moment. She's got to wait until all the Oromorph is gone. If she moans early, that, oh, you've got to give it a try, Mrs. Well, you've got to give it a good try. But all that means is that a week goes past and Doreen's still in excruciating pain with no relief. Doreen's been resting on the bed today, and she's just come into the kitchen, yet again, crying, upset, trying to breathe. And I tell her, look, you can't breathe because you're panicking. She says she's terrified as to what the future holds, and that's why she panics. And it's understandable. After 22 months of constant pain, getting nowhere, you don't even know what your original problem is. How on earth can a doctor treat you for something when they don't know what they're treating you for? It just seems ridiculous. 18th of October, sent an email to Buntingford Medical Centre to try and gee someone along a little bit to realise just how bad Doreen's plight is. And it ain't getting any better. In fact, it gets worse. Every day is worse than the day before. The reason I send emails is they're effective. If you phone, well, you're on the phone for a long while and you're paying for it. It's your money. You get some wally telling you about COVID-19, as if we didn't bloody well know about COVID after all this time. Then you're on hold, playing some nice music. You're paying. Telephone calls? Well, I'm told by a receptionist they don't read my letters. Telephone calls? They can always say, well, we didn't get the call, or we didn't get the letter, we're not aware of the problem. emails, they're a different matter. If you send an email, you know it's been delivered. If it isn't delivered, you get a message back saying unable to deliver. So you know they've got it. Well, from the time I sent that email, within 10 minutes of sending it, Doreen gets a phone call from the doctors. The lady on the other end of the phone's not happy at all. Well, that makes bloody three of us, doesn't it? And tells Doreen in no uncertain terms not to ever send any more emails, as it's not the way they work. We have to do it through telephone calls so that we can work together to resolve problems. Well, yeah, I can look back on 22 months and realise just how fortunate we are with telephone calls and resolving problems. We've got nowhere in 22 months. Absolutely bloody nowhere. She says that the elusive Dr. Nicholson will call her about 8:30. But later in the conversation she changed that to sometime tomorrow. I suppose that's because he's overwhelmed with work. In the conversation, she said to Doreen, "You should not be putting your feet back in water." Well, there's a bloody revelation, isn't it? Why didn't me and Doreen think of that? Well, the reason she puts her feet in water because she's got no bloody pain relief. From the time I sent the email to the time of the phone call, 10 minutes, Buntingford had got in touch with Broomfield. Now, Broomfield said they didn't have any record of Doreen being in hospital. Now, you've got to remember, Doreen's in a specialist burn unit. She's there for 18 days. All the skin removed on both feet. Skin grafts. No record. Bloody hell. But that's how quick emails work. Within 10 minutes, Buntingford had seen the email, seen the pictures, phoned up Broomfield and called me, all within 10 minutes. Would you have got that with a phone call or a letter? No, you bloody wouldn't, would you? Well, we had a call from Dr. Samuel's receptionist at the pain clinic in Lister. Remember, Doreen left a message with them on Friday the 15th of October. The lady said they've got no knowledge of Doreen ever being in hospital, let alone having skin grafts. It really is annoying, frustrating, disappointing when you continually find out that no one is talking to anyone else. Dr. Samuels is in charge of Doreen's pain management. How on earth can he help Doreen if he don't even know she's been in hospital for skin grafts? "19th. Dr. Nicholson phoned about 11 o'clock. What a remarkably changed man. He was polite, pleasant, and most of all, concerned about Doreen's health. He couldn't have been nicer, and spent at least 20 minutes out of his busy schedule talking to her on the phone. He's now sent down a prescription for 5 bottles of Oromorph. They've each got 100 millilitres in. It's the same strength as before, but now the dosage has been upped to 6 teaspoons a day. And I'm going to keep a close check on Doreen to see how much she takes and what the results are. It's the 20th, so a day's gone past. Doreen says flatly it don't work. 21st of October. Doreen went to lay on the bed at about 9 o'clock in the morning. Now, Doreen ain't been to bed for way over 2 months. She's either on the settee all day or sitting in the kitchen. And sitting in the kitchen, I mean, we live in a small bungalow, is a bloody nuisance. Suits her. She says it's cold, her feet are on the floor, blah, blah. I can't even get out and make a cup of tea with myself, and I go hours without a cup of tea because I can't get in the kitchen. And if I go in the kitchen and say, "Dor, can you put the kettle?" "Oh, bloody hell." So I'm stuck. So I keep popping my head in the bedroom, and she's breathing. So I think, leave her asleep. She ain't slept for God knows how long. Well, I woke her at 10:30 in the evening. 13.5 hours sleep. Possibly she was unconscious. I don't know. When she got up and put her feet on the floor, same thing, started crying immediately with pain. And it took about 2 hours for her feet in warm water for the pain to ease off. Same story as yesterday. In bed all day and as miserable as sin when she's up. Monday the 25th. Yesterday Doreen went to bed about 8 o'clock in the morning. Got up 10:30 in the evening. And I knew when she got up I could hear her screaming and shouting hysterically. I'm in the computer room with earphones on so I can keep things turned down and not make a noise and wake her up and disturb her. When I get into the kitchen, I met with Doreen, completely out of control, shouting abuse as to why I didn't hear her when she first started to ask. Well, it's the same old rubbish. You don't care, don't hear me, don't do nothing. Bloody hell. Now, another problem. Her left arm's not working. She can move her arm from the elbow. She can't move it from the shoulder. She can't move her wrist. And she can't move her fingers at all. She says she doesn't have any pain in her hand. This continued all day until I went to bed 1 o'clock in the morning, just pleased to lie on the bed and close my eyes. The Oromorph, she says, does help somewhat, and by taking 2 teaspoons it eases the pain for a while. Does nothing for the pain she's had all the while, but it does help a little bit with the pain she's now got in the skin grafts on her feet. Same old thing with yet another problem thrown in. All the same old things. Original pain, skin grafts, now she can't move her left arm. She phones the surgery early in the morning, which she's got to do. She's got no Oromorph left, and a left arm that don't work. All sounds perfectly sensible to me after all this time. So what do you expect? When I tell her about, get on and she says she's going to leave it for a day. It's the 26th. Doreen was in bed all night, but when she got up at 8 o'clock, feet on the floor, started crying. I have to get out of bed in a rush, get in the kitchen, get a washing up bowl of plain warm water so she can get to the kitchen 14 paces and put her feet in warm water to ease the pain. Now that's some kind of progress, isn't it, after all this time? Every day is a miserable experience for her and for me, and it's never ending. Doreen phoned about 9:30 and the receptionist said he will call her sometime today. Well, he does call, and he says he's going to send someone out to look at Doreen's arm. It's 4 o'clock in the afternoon and a doctor came to see Doreen about her arm. His name was R. Ragafan. What an absolute smashing bloke he was. A real kind, polite gentleman who took the time to listen. I tried to explain to him Doreen's last 2 years because he didn't have a clue, obviously. I think he'd been sent by 111. And I apologised that he'd been thrown in the deep end, not knowing anything. Well, he examined Doreen's arm and said that she had wrist drop and had to go to hospital to have it looked at by a bone specialist. He then had a look at her feet. Now remember, he's not there to look at her feet, but he said, "You've got a problem because I can smell your feet." He undone some of the bandages very gingerly and looked, and she's got ulcers that are weeping. He said he's really concerned that the ulcers will damage the skin grafts. and she's got to go to hospital. He patiently wrote a letter and left it here for Doreen to take to hospital when she goes. And he left some penicillin type tablets to try and fight the infection in her feet. Now remember, this doctor only came to look at Doreen's arm, but he went much further. Smashing bloke. It's a never ending battle for us. Her dressings should have been changed regularly. They haven't been. She can't do it. The pain's too great. No medication, and now got infected ulcerations. What more can go wrong in your life? Well, it's today, Friday the 29th. The washing machine got me out of bed at 7 o'clock in the morning, as Doreen knew it would. She's been up all night, as usual. The noise of it running in our small bungalow, bloody hard to miss. So I'm up, and she's dithering with what to do. And I say, for Christ's sake, you're not dithering. We've got to phone an ambulance and get you in hospital. Yeah, well, I need a bit. And I say, for Christ's sake, and we finish up having an argument in it. In the end, I did phone. And I'm calling 999, our emergency number. And I'm placed in a waiting queue for 999. That's not a good sign, is it? In the end, excuse the coughing, a young lady took all our details and arranged for an ambulance to come and pick Doreen up. She left about 8:50. I'm going to end this video now and start part 5 when I stop coughing and when I find out a bit more about what's happening with Doreen. Talk to you in another video.